Hello. Let us demystify the colonoscopy procedure for you. First, it is very important that you carefully follow your clinic's instructions for the cleansing of your colon. Make sure you read these at least a week ahead of time so that you will have time to shop for supplies you may need to get from a pharmacy. Your clinic may instruct you to follow a limited diet, such as no solid food and only clear liquids, starting the day before your procedure and fasting for a few hours prior to the colonoscopy. You will also be prescribed a bowel preparation, which may necessitate drinking large amounts of liquid in order to perform the colonoscopy and achieve the best results for you. It is important to drink all of the solution in the set amount of time, as instructed by your clinic. As soon as you start the preparation, you will need to stay near a bathroom. This will likely mean canceling any plans for the day, including work. By following your bowel preparation instructions carefully, you will have a greater chance of fully emptying your bowel and allowing your doctor to successfully examine your colon. This will help your doctor detect, diagnose, and treat any abnormalities. On the day of the examination, the medical staff will monitor your vital signs and try and make you as comfortable as possible. According to your choice and the suggestion of the doctor, you may be given a mild sedative and/or anesthesia. A colonoscopy typically takes about 20 to 30 minutes. During the procedure, you will lie on a table while a colonoscope, or simply scope, is inserted into the anus and gently guided up the rectum and through the entire length of the colon. The camera at the tip of the scope sends video images to a computer screen to allow the doctor to examine the lining of the large intestine. Air, CO2, and in certain instances, water might be introduced via the scope during the procedure. A colonoscope can reveal irritated and inflamed tissues, ulcers, polyps, and other findings such as little pockets called diverticulosis. The scope channel can also be used to introduce instruments to its tip, such as tools that allow for tissue sampling, called the biopsy, or polyp removal. Your position on the table may be changed several times so that the scope can be adjusted for better viewing. When the scope is moved or air is introduced, it is possible that you feel abdominal cramping or the urge to have a bowel movement. After the exam, if you have received a sedative, it takes about an hour to recover enough to be discharged home. As you may receive a sedative or anesthesia, you will need to plan ahead to make arrangements for a ride home after the procedure, since it can take up to 24 hours for the anesthesia to completely wear off. You may also feel bloated or pass gas for a few hours after the exam. Walking may help relieve any discomfort. You can generally return to a regular diet following the procedure. Rest assured that the specialized staff and physicians at your clinic will give you personalized and compassionate care during your entire stay.